Informal Assessment Strategy for course PID 3104. The assessment strategy that I've chosen is a combination of performance task checklist and peer assessment. The approach that I'm using for informal assessment works best in a course that has a large hands-on component. For example, in the nursing course we have a very heavy weight upon actual skills and hands-on techniques that the students need to learn. In order for you to be able to achieve the success that you want with the checklist, especially a skills-based checklist, it's important that you have the space needed for the students to practice with that checklist and whatever equipment is needed to complete those skills. So for example, in the nursing course we have the labs and we have any of the equipment needed to complete the checklist scenarios. Performance task checklist. The student has a skill to learn and needs to practice and eventually demonstrate proficiency of that skill. In nursing, for example, such a skill would be a subcutaneous injection. So the performance task now for each student is to give an injection to a dummy in the laboratory. The checklist is handed out to each student and contains an itemized step-by-step process of how to perform the task and the rationale for each step in the checklist. The peer assessment portion is such that in groups of two, the students work together, and while one practices the task, the other observes the checklist and provides informal feedback. The key to the success of and the limitation of the strategy is one and the same, and that is student motivation and discipline. The students need to be motivated to practice in groups of two, and in that they need to be disciplined enough to observe each other closely and compare each other's performance to the checklist. It is possible for bad habits to be formed if they're not watching each other closely. It is also possible for bad habits to be formed if they're not able to recognize excellence in performance. For example, did they observe the initial demonstration by the instructor closely? Are they comparing their partner's performance to that demonstration? The instructor can also help out by doing spot checks, but ultimately it is up to the students to ask questions where they think they may have gaps in their knowledge, as the instructor is not able to watch all groups at once. There are several advantages to this form of informal assessment. Number one, the students get a lot of practice time with the skill. Number two, they get immediate and ongoing informal feedback from each other. Number three, the instructor is able to observe the different groups working and give informal feedback. Number four, the students working the checklist also learn and internalize as they observe their partner performing the skill. Some of the best practices for this strategy are as follows. Number one, a clear and concise demonstration by the instructor of the task that is to be practiced by the students. This should be done at the beginning of lab, and the instructor should be careful that they point out each step in the checklist as they perform it in front of the students. When the instructor breaks the students off into pairs, he or she should be clear about what is expected of their behavior and performance while they practice together, and how much time is allotted for that practice. He should also let them know that at some point during the lab, perhaps in 30 minutes, one of the sets of practicing students will be picked at random to demonstrate the skill before the rest of the class. This galvanizes, motivates the students to practice hard, knowing that they will be demonstrating for the others, and enables the others to critique that group and learn when the demonstration by the students is made. In addition, the instructor should round on the students frequently, randomly dropping into pairs as they practice, getting informal feedback and giving informal feedback from the groups. As this feedback is gathered, the instructor may decide to repeat the demo him or herself, clarify steps within the checklist, or move on to the next task if the students have mastered the current one and are bored. Now we will look at validity and reliability. Content validity. The skills checklist content is based on theory taught in the classroom and directly correlated to the steps demonstrated before the class by the instructor in the lab. Predictive validity. If a student is able to perform this task in accordance with the checklist, they should be able to perform the task in the clinical setting when working with patients. The construct that we're measuring is professionalism and critical thinking, and thus if a student is able to work through this scenario in the lab, they have demonstrated professionalism and critical thinking. Consequence validity, which impacts reliability, is maintained in that the students work in pairs. This decreases their anxiety, offers support in a non-competitive environment. They're motivated to achieve the results for the future impact on patients, not just to pass their skill checkouts tests. Their checkout tests are worth only a small amount, and this as well helps to decrease their anxiety. Finally, the checkout test that they have later is exactly the same as the process that they go through during scenario practice with each other. So the anxiety levels should be low. The process validity, which also impacts reliability, is maintained in that the checklist items are practical and clear. There's no ambiguity. Each item describes clearly the action to be taken and the rationale for each action. They're arranged in sequential order, and the same checklist used in skill testing and in the clinical setting is what is used to practice with the strategy in the lab.